All right, so I think we are live now. We're just waiting for some people to log on. We are live, I see that, so we'll wait a minute or two to get some people on the feed, and then we'll get started here. So just a few minutes, folks. Hi, Jennifer. Jinx. All right, well, I'll do my part as everybody's signing on, and we're on for an hour, so and we'll also repeat the broadcast on our Facebook page and on our website and everything, so you can check it out there as well. So to just get started, hi everyone. I'm Dan. I'm the Director of Marketing and Communications here at Chase Brexton, and welcome to our first COVID Vax Chat Town Hall. With me tonight, I have Maisha Davis, our Director of Social Work and Outreach, Randall Leonard, a staff therapist with our LGBTQ Center of Health Equity, and Dr. Sebastian Ruhs, Chase Brexton's Chief Medical Officer. So we want to use this time and create an open and honest discussion where everyone feels free and unjudged talking about their fears and any rumors that they may have heard around COVID vaccine. So before we start, we just want to ask each of you to help us make this a safe space, be respectful of opinions that you might not necessarily agree with in the comments, and just be open to listening and active listening as much as you can. So with that, we have some questions that we've got before the broadcast, but if you have questions, please feel free to share them in the chat, and we'll take it from there. So let me look at some of the questions that we got before the before going live tonight, and I'll just pick one out here. Let's see. This was a pretty we got this several times, so I'll kind of start off with this. Will vaccines cause infertility? So, Dr. Ruhs, do you want to lead off the conversation on that one?
Sure, I'm happy to. Thanks, Dan. Very good question, and a very powerful question that I've heard multiple times going around on the internet and platforms like Facebook, and certainly a message that I understand can scare some people away from considering getting the vaccine. So here's what we know. There's no scientific evidence that this is true. There was in the beginning a concern that was raised by somebody that a protein that is produced somewhere in this cycle of the immune defense after getting the vaccine might cause any issues with fertility, but this is proven not to be true. This is nothing but a rumor at this point, and I can reassure there's not the remotest scientific evidence that there's any substance to this. And just want to say this right up front for whoever this may matter. I've received both shots of the vaccine myself, so I'm not promoting anything here that I'm not taking myself and that I'm not believing in myself.
Nice. So actually, speaking of the vaccine, getting both shots, I also have received both of the vaccine doses. And I guess maybe this is a personal question of mine that I wanted to ask all of you. And I noticed that, so after my second shot, I had a lot of sort of side effects. I got fever, body chills, cough for about like 12 to 16 hours, and then it all magically went away. But my coworker, who also received the shot, both doses at around the same time as I did, felt nothing. So I guess the question is, why are the side effects so different between different people?
So another very good question, and this one we don't have a good answer to. So couple of nuances to answer some parts of the question as good as we can. The first thing is, why do some people get sick from the flu in the flu season and others don't, right? So everyone's immune system responds differently, and it responds differently at different times. So I think this is some part that plays into this. There's the question, if I would get the vaccine this week and I have an immune response, would I have one if I would have gotten it 2 weeks later? Possibly the response might have been different. So this might be one part to answer the question. The other one is the severity of how the body responds to the vaccine, right? Again, if I'm getting the vaccine during a time where my immune system responds a little bit stronger, I get those symptoms and I get those side effects. And then there's also a difference between the first and the second shot, right? So the immune system gets primed to what the virus looks like, and then with being primed to that, develops antibodies and develops an immune response. And so usually that immune response is a lot less after the first dose, because that's the initial primer when the immune system gets challenged with an image of what the virus looks like and then forms the antibodies. So when we get the second dose, there are more people who have an immune response, because at that point, the immune system knows what the surface of the virus looks like and already has preformed a certain amount of antibodies. So it's a lot easier for the immune system to respond faster, and it's a lot easier for the immune system to respond heavily. But having all of this said, actually it's a good thing that we're seeing this immune response happening, because it means that our body is actually able to respond to this artificial invader. So in this case, it's only an image of the invader, which means there's a good chance that our immune system responded to it and that we are protected against COVID in case we're actually getting in contact with the actual disease.
I like that explanation. Yeah, thank you, Dr. Ruhs, for that insight, because I also have had both of the shots of Moderna, and the first time it was like that 48 hours of just feeling that pain at the injection site. And then the next time, for the second one, I was extremely lethargic and just got, some chills, but I definitely, slept for close to a day. And then just like that, everything just went away. And I've had friends that have had fevers, in response to it, and chills, and other people got upset stomachs. And it's just like, really just understanding how our bodies respond to, like you said, this invader. And to that first question too about fertility, one of the things that I have been, I guess this is a question too, that I have seen and a lot of misconceptions around is the fact that the concept of being called a sterilizing vaccine. Yeah, I've seen a lot of people ask questions specifically about that, and what is a sterilizing vaccine, and just asking about, that in particular.
Right. Yeah, good point. I think maybe just by the wording, it might be leading to the thought: is it sterilizing me from a fertility perspective? And so these kind of two, it's the same word used in two different contexts, and these contexts don't have anything to do with each other. Sterilizing from a fertility perspective has nothing to do with sterilizing from an immunological standpoint. So a sterilizing vaccine just means that it's essentially 100% effective. So it doesn't only decrease symptomatic disease or eliminate symptomatic disease, it at the same time also eliminates asymptomatic carriers. It's rare for vaccines to do that. Most vaccines are not fully sterilizing. The polio vaccine would be the smallpox vaccine would be an example of a sterilizing vaccine, but most other vaccines that we know are not fully sterilizing.
Gotcha. Cool. Two different contexts.
So I wanted to kind of maybe switch things up and get a little existential. We got a question that came in before the chat. So I'll ask that, and I think we have some questions in the chat, so we'll get to those. So the question that we got beforehand said, I believe in the efficacy of the vaccine and I can't wait to get mine, but I have several family members that are adamant that they will not receive it. Some of them contend that it's a government ploy, while others say there isn't enough research that highlights the after effects. What can I do to convince them that the vaccine is safe and they should take it? So this is probably maybe our social workers, Maisha and Randall, if you want to chime in on this question.
Sure, absolutely. Yeah, so I'll start. I'll just say, you know, I get it. I think, you know, like all of you, you know, we understand by working, by the nature of our work, like we really get and understand fully the importance of what this looks like. But I will tell you that, you know, I think it's important to just honor for folks where they are as it relates to medical mistrust in our communities, right? That's legit, and there is plenty of examples throughout our history that really do demonstrate and validate those fears for folks, because they have been and know of so many different situations over time where people were mistreated and abused under the hands of medical providers, specifically as it relates to kind of these population-wide types of treatments or care or research or things of that nature. And so while I know that it's been very difficult for family members and friends and different communities of folks to really be able to understand or trust that this is a thing that I need to do, right? Or trust in the efficacy of it. I think when we went through the first presentation internally at Chase that talked about and compared the research and really gave very detailed explanations, Sebastian, that you shared with everyone, I thought that was very powerful in helping people to understand, helping myself, right, to understand what am I really looking at. And then I thought how we, as a program, then talked about the medical mistrust and really just honored that for folks, really helped to rest me ashore, you know, that this is the right thing for me to do. And so in my conversations with family, friends, community outside of the healthcare profession that are struggling with whether to or whether not to, I simply just validate their fears and their concerns, because they're valid and that's okay, and they own that. And then I have been really diligent in encouraging folks to do their own research, legitimate research, look at these very specific, you know, elements about the vaccine to before they start making decisions. Really I've been encouraging folks hands down to talk to a provider that they trust. I was able to do that for myself as well, just to really get multiple perspectives on what this is talking about. I think if we just kind of zone in on what's on social media and zone in on folks' fears and zone in on even just solely the information coming from like the CDC or the government, it is enough to kind of, you know, become overwhelming and then back you up a little bit to say, you know what, maybe this isn't right for me. And so I'm a part of quite a few groups, family groups, close friends, and we've had these conversations, and I've really shared with them why I made a decision to be vaccinated, and share a lot of that information that was shared with us internally to help people make decisions for themselves and really point them in the right direction to where to get their questions answered with fact, you know, and trusted opinion, medical opinion. So
I think I agree with you, Maisha, completely. I mean, so many of us have seen, you know, even here at Henrietta Lacks, there's so many individuals who, you know, it's understandable why we would question something like this. Absolutely understandable. And if anything, you know, anxiety to a bit, you know, to a certain point, anxiety is natural, and fear. All of our emotions are attempting to protect us. Our brain's number one function is actually to focus on safety. And so, and what you're saying too about that concept of trust what I usually say to people is that think of somebody who you trust and think of somebody who you don't trust. And those two people can say the exact same thing, and it's going to hit different. It's just going to hit different.
Absolutely.
Yeah. Yeah. So first of all, for that individual, they have they're part of a family, and to a degree, that family, and this is assumptive, but maybe that family trusts this individual a little bit, but still the information that they're getting from the outside, or maybe they do just want to wait for a little bit in order to just see like, hey, let's just see where this is going to go. But social media and all of these other things are giving so much information. I think that person, there's a lot that you can do. I mean, as a therapist, I validate oftentimes the people in my healing space, what they're going through. I validate their thoughts and just have a conversation, and that patience of just like, hey, here's a little bit more information, but I also completely understand where you're coming from, because we all have the right to decide, what we're going to do with our bodies. So just that consistent patience and just having those conversations, because I get it, I'm also, part of a big family that a lot of times they're asking me for information. A lot of times they're not necessarily trusting what they're hearing, and it's that consistency of just like, I'm here, and we all need to see, where this is going to go.
I'm sorry. Go ahead, Dr. Ruhs.
I was just gonna give my my answer to how I usually respond to these fears and concerns. So and I usually start off with a question of what are you afraid of, or what makes you hesitant about the vaccine? And often it's what you said, Dan. It's was it produced too fast? Has it been tested long enough? Mm-hmm. And then really giving an explanation to those questions. So just to put this into a nice storyline. First, we're dealing with a new disease that we haven't had before. That we've only been knowing now for a little bit less than a year and a half. So yes, this is absolutely scary. And yes, this raises the question, why all of a sudden were we able to produce a bunch of different vaccines that on top of that are highly effective in throwing them on the market? So if I don't get any more information, I can see that how that ends up into a conspiracy theory very quickly and raises very concerning questions. But if we unwrap that story and see, well, the two first vaccines that were approved in the United States were mRNA vaccines. Yes, that's the first time we got mRNA vaccines approved. That is correct. But mRNA technology was not new. mRNA technology has been researched since the mid-90s. So for the last 25 years, not for vaccine purposes, but for actually something that is much more impactful, cancer research, and for research on how autoimmune diseases can be treated that we currently can't treat. And so there has been extensive research done, including animal research. And so there's a lot of experience knowing of the safety of these vaccines. And so now it's actually, it clicks, it makes sense. Now we have a new global pandemic. We have experts on mRNA research, and these experts said, well, we have this technology available. Why don't we just switch gears and try whether mRNA technology works for vaccines? And yes, it did. So this is where this all in a sudden, it didn't all in a sudden appear. It was already there. We just used it for a different purpose. And with respect to the testing and the approval, we're in 2021 now, but when the vaccines were researched, we were in 2020. Everything is high speed. We're holding meetings by the internet with people from the other side of the world. We can see them. There's the images are sharp, and that's how research works too. Experts in the world, they can communicate with each other in an extremely high-paced and fast way. They can establish testing centers for clinical trials in different areas in the world at the same time, highly effectively. And with that level of effectiveness, they were able to put together in these two trials 70,000 people of trial participants in just a matter of a couple of months. So this is actually amazing, and this is only possible because all of this happened in 2020. If we would have had that pandemic in 1985, this would have been a total disaster. So again, yes, I understand these fears, but we have to put this into a storyline, and all of a sudden, this makes a lot more sense. And we're able to produce this level of data and information just because all of this happened in 2020.
Yeah.
Yeah.
Appreciate
Dan,
that.
I do too. I would just want to add, kind of piggybacking off of the second question you asked about, the symptoms that folks had after receiving the first and the second doses. I think what's been also helpful for me, and then for my circles of folk, is that people have been sharing their experiences, right, on social media with how they were doing after the first vaccine and how they were doing after the second vaccine, and how they've been able to register or get access to the doses. And so I think that's also helpful to kind of create a sense of community and a sense of urgency, and also it's a sense of calm, if you will, that there are those of us who are out there willing to be the first, and have done so and are okay and experiencing these results. I think that also has supported our arguments to help our families and our friends out, right? To know that, what, this is okay. And I think all of us kind of sharing together has been helpful. So it's like the double-edged sword of social media, right? Like there's some good stuff that can come out of sharing together as well, and not just the fear and the myths and the anxiety, but really the community that's supporting one another and uplifting one another as well. So I've kind of used that to also help pull people along, bring people along, where they might feel a little stuck.
Yeah. I appreciate both of these, because with Dr. Ruhs, because oftentimes, that scientific background and what you shared, there are a lot of people who are, again, a lot of anxiety around just, the science aspect, because it seems like, what is this? How do we do this? And it's really useful to get that explanation of and those connecting points of seeing, especially like what you said, comparing it to 1985 versus now, and how we were able to kind of move a little bit quicker. And to Maisha's point, it's like, I think oftentimes when we're having these conversations, it's just like, don't listen to social media. Well, not necessarily. It can be a double-edged sword. You can also utilize community to see hey, here's my experience with it too, as a way of, encouraging.
Mm-hmm. Mm-hmm. Absolutely.
And to your point, Randall and Dr. Ruhs and Maisha, the power of social media, we share things on our Facebook page, and to Maisha's original point about the information that we shared at Chase Brexton internally, we've put a lot of that information on chasebrexton.org. We have a whole vaccine page that has a lot of that research, and it's been reviewed, by our team, and has been sort of parsed in a way that's easy for folks to get and understand. And it's so we'll put that comment, or we'll put the link in the comments, and make sure to check it out. And also, if you're coming to Chase Brexton, it's ask the people that are giving you care, and they'll, we have resources there for you to take away as well, if you want to sort of have something tactile that you want to ponder on. So with that, I have a question from the audience, and folks on the stream, feel free to keep posting questions in the comments chats box. But this is from Jennifer Mayhew, and she asks, after both doses of the vaccine, Moderna, Pfizer, or single dose Johnson & Johnson, how long until immunity is achieved?
Good question.
Great question.
Yeah. So just to be safe for the Moderna and Pfizer, the CDC has put an arbitrary timeline at 2 weeks. So they're saying that after 2 weeks we can assume that we have achieved full immunity. This could possibly be a lot faster. So again, having already primed the immune system with the first dose, and knowing that if people develop an immune reaction after the second dose, it's usually within 24 hours. And so this already means that our body or our immune system is working at high speed and full power and is boosting out antibodies and is producing antibodies. So we're probably pretty close to full immunity way sooner than 2 weeks. But just to be on the safe side, we're saying 2 weeks. With the Johnson & Johnson vaccine, so that the trial was actually conducted slightly differently, and they were looking into endpoints at 14 and 28 days. And so it looks like that at 28 days, the vaccine was slightly more effective than at 14 days. So that might be that because it's only a one-dose vaccine, it might take a little bit longer, or it might just purely be because of the study design. But with the Johnson & Johnson, we would say 4 weeks.
So, Dr. Ruhs, just another sort of follow-up question to that. Is there? Can you talk about any level of protection that happens after somebody receives the first dose of the Pfizer and Moderna?
Pfizer and Moderna, the data that was published after the trials were completed, they were pretty compelling. So they were roughly 95% both effective, 95 and 94% in preventing symptomatic disease. So the trials, what they did is if someone developed 6 symptoms, they announced themselves and then they were swabbed for COVID, and so there was a 95% reduction seen in people who were symptomatic from COVID.
Mm-hmm. Thanks. And kind of keeping on some of the medical pieces of the vaccine and some of the questions that we received. So there was some comments about sort of questioning why people would still have to wear masks if they've gotten both doses of the vaccine, and the follow-up question to that is, once you get both shots, can you still carry the virus and pass it on to others? Like, what's that all about, basically?
Right. Again, very good questions, and questions where we don't have the answers to quite yet. So which brings us back to what we talked about initially, sterilizing vaccines versus non-sterilizing vaccines. And since most vaccines are not sterilizing, we're assuming that this is also true for the Pfizer and the Moderna vaccine. We're continuing to wear masks afterwards because we don't know if, and if then how many of those who have received both doses can still get infected but be asymptomatic and then potentially still pass the virus on to other unvaccinated people. And so until we have an answer to that, we should continue wearing masks, especially since the amount of vaccinated people in the community are still relatively low. So there's still a lot of vulnerable people out there that we can potentially pass it on. And if they're not vaccinated, they have a much higher risk of getting sick from COVID and then also getting severely ill from COVID. So in order to prevent that, until we're closer to higher numbers of people who have been vaccinated, until we have more information on whether we can spread the illness, or spread the virus, we should continue wearing masks. And I've seen comments that were actually putting that into a negative context. I got vaccinated. Why should I get vaccinated if I still have to wear the mask? Well, I think these are two different things, and there's a huge benefit of getting vaccinated, right? For me, getting vaccinated means I'm extremely unlikely to die, and this is a main benefit, right? I'm not 100% certain, but very, very certain that it's extremely unlikely for me to end up in the ICU and develop a fatal course of COVID because I'm vaccinated. Whether I can still pass the virus on while I'm still personally protected and safe, that's a second question. And yes, I still have a duty to the rest of society to not spread COVID, and that is the duty that I'm fulfilling by continuing to wear the mask until we have more certainty on this.
And just to say again, based on what we had talked about in the beginning, because of what you had said too about sterilizing versus non-sterilizing. So sterilizing again is a vaccine that helps people, or prevents people from getting sick, and prevents transmission as well. Just to kind of follow up on that. And non-sterilizing, if I'm understanding you, is preventing you from getting sick, but doesn't necessarily prevent the transmission.
That is correct. Yeah.
Okay. Because I just know whenever people hear that sterilizing vaccine part, like the first thing, a lot of times people go to is the other reason why fertility is that concern. Yeah.
Mm-hmm.
It's almost like they should put a sticker on it, right?
Yeah, like does not mean infertility.
Right. Yeah. So we actually have another question in the comments from Aaron Ainsley, and the question is, can someone speak to vaccine equity among underserved communities, BIPOC, LGBT+, etc.? How might the community reach vaccine equity? Randall, Maisha, you guys want to go first?
Yeah, this is a heavy.
I work at Chase.
Heavy. Yeah, I mean, so I think, and I don't have an answer like a solid. This is what we should be doing. I do think, though, that when we acknowledge and recognize the disparity that we've observed already, right, in the past year of very specific groups having greater occurrences of having COVID, as well as severe cases of COVID, as well as COVID death, right? We then need to then prioritize, right, the vaccine distribution specifically to those populations where we see there's disparity. And we've done that to a degree when we are looking at older patients, right? We know who have had some greater challenges with how they respond to the virus itself. And so I think any strategy that is looking to get the vaccine out to these populations has to prioritize access in a way that touches these populations, but not just access. It also has to be partnered with education. And I think what we've seen already, right? We already know there are populations of us who are suspect, who are not excited about the vaccine, who have these fears and anxieties, and are like, no, thank you. And oftentimes we know that those are the populations who are having who are going to be most impacted by COVID itself disparately. So I think all of our strategies have to really focus in on not just getting the doses or the vaccines to those populations, but really accompanying that with really strong campaigns of education. Just the facts that we have been discussing, the facts that we know helps to make a difference in how we make our decisions about our own lives and our own healthcare. And so I'm not sure how that needs to look, but I do feel like, it's been on the news, right? We've been hearing about it most recently, particularly here in the city, in Baltimore City. We've been hearing about this is an issue already, right? We're about a quarter in to the year, a quarter into providing the vaccine across the state, and we already see that we're there. I would love to see strategies that are more proactive, that really are targeted, that have built-in mechanisms, if you will, to support the delivery of the vaccine to the folks who are priority populations and who need it most. And so I don't know what that should look like. I do think we should probably go back to the drawing board a little bit, take a step back, and really, be a little more thoughtful in how we make that happen, and not, without getting too political, not make this a punitive piece. You know what I'm saying? We can finger point all day. That's it. But what are we going to do collectively to get the vaccines to the folks who need it most? So.
Yeah. And to piggyback on that, Maisha, I agree with you. And also, if there's anything I know about marginalized communities, we are extremely strong. Marginalized communities are strong. They are adaptive. They are going to find ways to. You're right. There's not really a good answer to this, and also this is one of the reasons why I came to work at Chase. Like the fact that Chase offers the vaccines as well, and the fact that I can talk to other people and talk straight to this community, a community that I'm a part of. And there are certain ways, if I can be honest, I believe that Chase, we need to be doing better. And in those ways, community has found just like, what, we're going to, do what it takes in order to protect ourselves. So I am really glad that we are offering the vaccine at Chase, and I am glad that we are having these conversations amongst each other to be like, if I'm not able to get it at this particular place, and just banding together that rooted village of just like other, especially for me, like I love having conversations with other queer folk who were just like, here was my experience with it. Here's what happened, if I went into a particular place and I got misgendered at this place, just things to kind of keep in mind, and just having those conversations beforehand, because we're strong and we're going to figure out, how to do this. But yeah, the infrastructure, in so many ways, the infrastructure just hasn't been there. But I also think that we can adapt and work together as a community to get what we need if, for those people that want to go ahead and get the vaccine.
Yeah. Yeah, I think to kind of underscore that, I know a lot of the conversations that we've been having internally have been about specifically about access to the vaccine. So getting folks to be able to make appointments who may not necessarily have access to what is a very digital, computerized,
automated process.
Automated process. How to get folks onto to get them to the physical place to get vaccinated, right? Because if it's across town, so we have some resources that we put on chasebrexton.org. I know there's a phone number that folks can call, and they'll navigate you and help you to try to get, scheduling an appointment. And they might also have some transportation options for you as well. So I think that's run through the Maryland Department of Health. So we'll share that in the comments as well. So with that, let me go back to some of our questions, looking in the chat box to see if we have anything new.
Yeah, that was my big question too, is of course that piece about transportation. So I'm glad that we have some of those, because that's the thing, like access is always going to be an extremely important.
Yeah. Agreed.
So we got this question a couple of weeks ago, but we wanted to pose it to this group, and it was a startling question when we received it. So the question is this a plot to sterilize Black women? That's the question. So I don't know who wants to start. Dr. Ruhs from.
I can start with a medical component on this. So again, I think this feeds into what we have said earlier of mistrust, mistrust in medical research, and awakening of some of the memories of what unethical things were done in medicine in the past. So this is where the base of this thought, or this fear originates from. Just looking at it from a pure medical perspective on the vaccine, we now have only have 3 vaccines available in the US. None of these vaccines are being distributed to one region, one area, one community only. They're randomly being handed out, and the vaccine. COVID-19, neither COVID-19 as the disease nor the vaccine, when it gets in contact with a person, can make a difference on, or can recognize race, ethnic background, religion, sexual orientation, or any of this. A vaccine and the virus itself both do the same thing in every body. So it would be difficult to explain how a vaccine could target a certain group, a certain gender, a certain community, whereas it's given out randomly to everybody. If someone would go to one of the large health department sites where they were giving out the vaccines, if someone goes down to the mass vaccination sites at the M&T Stadium, there are people of all different backgrounds standing in the same line, and the person before and behind me is getting the same vaccine that I am getting. So just from a logic, just thinking about it logically, it would be very difficult to come up with an explanation of how this would be possible. And then looking at the data of who has received the vaccine so far, it's way over 50%, close to 60% last time when I checked, of Caucasians in the United States who have been vaccinated so far. So the vast majority of people who have received the vaccines are not the ones where these fears or these concerns circle around about. So maybe Maisha or Randall, you can add something onto this, but yeah, just medically and logically thinking about how vaccines work and how they're being distributed, it's difficult to build this argument.
I think I think that it's a valid question to ask. I think it's an important question to ask, specifically because it is showing, the care and concern that we have about ourselves as Black folks. I think that just like what I was saying, Henrietta Lacks, there has been consistently in this country throughout, the years that we have been here, just ways that our community, the Black community, just has been, continuously
abused,
lessered and abused. Absolutely. Thank you. I mean, abused over and over and over again. And I think that there is going to be anxiety there, especially when you're saying things like new technology, and while we understand, we can look at the science and see like, hey, this is, or, us in the medical field can look at all of these things and we're trying to explain. And also that new technology piece can come across as being like, well, how new? And if this is, these new technologies are always creating new things. Can this new technology look at race now? And I think that it's a valid question to ask. And in the middle of this pandemic, what it's going to come down to for so many people is a risk assessment. Because we have seen what COVID can do. And I remember in the beginning, there was this rumor going around that, COVID couldn't affect, the Black community. In the beginning, when we were all trying to pull information or trying to figure things out, and social media was spreading around saying like, it's not going to affect you. And there was a whole meme associated with that too. And then we started seeing like how it can ravage. And so I think at the end of the day, like these questions, they have to be asked. They're important ones. And I can see how some people be like, why are we asking that question? But other people, especially, for me, I'm like, oh, I get it. That's a question that I would want to be asked. And I think it comes down to that conceptualization of risk. I personally don't believe that it does, personally. Both of my parents, my father was born in 1933, and my mom was born in 1944, and they both got the vaccine, and a lot of people in my family got the vaccine too. And I completely understand, just based on the history of this country, why that's a consideration.
Thank you both for that. I just simply go back to, listen, I plain and simple, I'm not above conspiracy theory in my life. You know what I mean? Like, I get it. And it's we live in a society more so now than ever before where there are energies out there that prey on our fears and our insecurities. They prey on our divisiveness. And it's in that their interest that we kind of remain in this very siloed, very aggressive, separate kind of stance with each other. And this is just, you know, so when things like this kind of circulate, I do believe it's really about kind of holding, you know, you can't, power can't be obtained when people are fighting, right? People are, there's more, as much, the way, as much as we can keep folks divided on the very simplest of things, the less likely we are to kind of galvanize our energy and our strength and our power to change, right? To change the culture, whatever that change should look like. And so I oftentimes kind of see myself looking at these conspiracies and these concerns as being as us being manipulated in some ways, you know what I mean? And so I have to check myself, because I get caught up in the matrix often, you know, when you hear these different things kind of coming along and trying to decipher what's real and what's not. And even when you go beyond, okay, I'm going to go beyond social media and actually do research, you know, all of the major news networks have their own vested interest in information as well, and what they produce and what they don't. So it's even going deeper, it's very challenging to really pull together the actual facts of the matter, right? So I simply, you know, do my best to do my due diligence to learn and find out as much as I can about the thing, not per se to support my own vantage point of view, fears, thoughts, anxieties, conspiracy theories, but to give me a valid foot to stand on for whatever decision I decide to make, right? And whatever decision I try to go with. And so I just encourage folks to go that way. What I will say for this particular vaccine, this situation, what I found to be reassuring to me, that this wasn't a targeted medical, you know, attempt on my life, was when the data that Dr. Ruhs shared with us early on about who participated in the clinical trials. I thought that was just helpful. That was just telling. I don't have a reason to believe that information was inaccurate. The numbers of people, the diversity of people, and all the different domains who participated in the clinical trials, I think was helpful for me and reassuring for me that this is not a deliberate attempt on my life. I do believe there are other deliberate attempts, but I don't know that, you know, I don't want to, I'm not there that this is what this is. The vaccines are for that. And so, you know, again, it's for me, and I think it should be for all of us. Get your information, find your facts. Like, you go on a hunt of your own. Talk to people who you think you can trust, who have solid facts and information, who will share that with you in a non-biased kind of way, and make the decision for yourself. But yeah, I think I'm comfortable in not believing that this is that, and it is hurtful and unfortunate that is in fact how some people believe, because understandably so, given what the history is here. But and so I'm sorry that that's what people, you know, have to carry around with them, you know. And I just hope that folks are able to figure out a way to pull themselves through that process and make the right decisions for themselves in a way that is, you know, healthy and safe for them. So.
Yeah.
Thank you, Maisha.
Yeah.
Well, I just wanted to just take a quick pause to just thank all three of you for coming on and sharing your stories and insights. I think this is part of what you're all talking about too, right? And making it sort of dynamic and not just, you know, a thing that you can find on the internet or a piece of research or whatever. Like, really kind of sharing those stories and being able to have difficult, complicated conversations around this topic and giving people the space to do that, I think is, you know, it's probably a little more work, right? It's always a little more work than just kind of pointing fingers or shaking your head and being dismissive. And I appreciate that. I appreciate that you guys, that everyone's, sharing their words and their truth and power. So thank you for that.
This is the work. This is good. And
What's
it's good work. Yeah, I said this is the work, and it's good work.
Yeah.
Especially, it's been a year since I've seen any of y'all, kind of like in person. And the last time we had these conversations, I mean, I love these conversations because this is the thing. It's like you can bring this information out to people that, and these are people that, we're all part of this community. So yeah, I love this work. This is why, that's why I'm here.
Yeah.
And keep, sending the questions, emailing us, putting them on our social media. Like we will, if you have questions, we will try to find the answers for you. We will try to connect you with whatever resources we can to get your questions answered, to get you more access to vaccines if there are no appointments in certain places. So like I think Maisha said earlier, we often talk about sort of the negative of social media, but this and like trusted places like Chase Brexton Healthcare social media is places where you can get viable, dynamic information. So
absolutely.
Continue to do that. We got a question in the comments here, and if I mispronounce your name, I apologize, from Brielle Glacial. And it's, why isn't there a kids version of the vaccine yet? Why are we just vaccinating adults?
Another very good question. So any kind of new medical product that is being brought on the market is in sequence first tested on animals, then healthy non-pregnant adults, and then if it's a medication on adults who have that particular illness, or in case of vaccines in adults who would be at risk of getting in contact with the disease. So while everything is being still investigated, whether it's A, safe, and B, effective, it's not being given to vulnerable populations such as pregnant women and children. So that's purely the reason for that. It's not because anyone thinks children are less important or they don't play a role in the transmission of the disease. It's really because kids and pregnant women need to be more protected than non-pregnant, otherwise healthy adults when it comes to vaccine approval. Now that we know it is effective and it is safe, it's actually already in clinical trials being tested on kids. So we're assuming that the EUA for an age extension into the lower age ranges is going to be out in the next couple of months.
Nice.
Thank you for that. So one of the things I think we've been seeing a lot of information about in the news and on social media is this Janssen & Johnson vaccine. So one of the questions we got is the J&J vaccine as effective as the others from Pfizer and Moderna? And maybe just some background in the differences.
Right. So another very good question. So first up front, the Moderna and the Pfizer are very similar in the way how they work, right? So it's not surprising that the results are very closely to each other. Plus, they went through the trial phase almost at an identical period of time. So they were also not dealing with different, prevalences of how prevalent COVID is in the community, and also with the variants that were circling around. So very similar in the way how they were conducted, very similar how they work. Not surprising, the results are very close to each other. The Johnson & Johnson vaccine is different. First, it's a different vaccine. It's not an mRNA-based vaccine. It's a DNA-based put into a different viral envelope to get it into the body. So the mechanism is slightly different, and it's also a one-dose shot and not two. And third, it ran through clinical trial at a time when there was a lot more COVID in the community, and when different variants that have an impact or might have an impact on the vaccine were already circling around. So we can't really compare the results with one another. If we're just looking at the numbers, then it looks like the Johnson & Johnson is not quite as effective at the as the Pfizer and Moderna are. But again, we're not comparing apples and apples here. If the Pfizer and the Moderna trials would have run at the same time on the same continents, then the numbers would probably be more closely to each other. Maybe not identical, but more closely to each other. And I think so the thing that we're looking at is how effective are they in preventing symptomatic disease, but that's really only one answer, or one answer that we get to a question. Another answer that we get to a second question is how effective are they in preventing severe disease and fatal disease especially. And if we're looking at that, and I think that's the most important question, is how effective is a vaccine in preventing people from dying, then we're getting results that are identical. Then we're getting 100% in all of these groups. In the clinical trials, there were no hospital admissions and no fatal outcomes in the Moderna and the Pfizer trials, and the same applies to the Johnson & Johnson. So it was 100% effective in preventing death.
Thank you for that. So it looks like we are coming up on the 7 o'clock hour, and just as I did almost a year ago when we had our first sort of town hall on COVID, I wanted to kind of give each of our panelists a minute to share some closing thoughts, and we'll just kind of go around the digital room. So Randall, anything that you'd like to share before we close out?
I'm just so thankful to, again, this has just been a really, really, really tough year. And even in looking, I do a lot of discussions with the people I hold space for on emotions. And I think I've even was talking about it last time, and how our emotions really can protect us in times like this. And oftentimes our emotions can also be telling us different things. Like, you know, I could be happy about something, but I can also be very sad, or I can also be very afraid. I can be happy that there is a vaccine on the front, but at the same time, I can be afraid of the effects, and also how does those effects, you know, how it will affect me. And so being kind to yourself has just been incredibly important. Many of us have gone through isolation. Many of us have transitioned to this place of, you know, the computer screen is a lot of our interaction with people. And that changes. I mean, that's an adjustment. And also, hopefully, as we are starting to move, you know, wherever this virus takes us, also just being kind to be like, we're going to have to learn how to socialize sometimes all over again, but also learning how to socialize within the newness of it all. And I also am very much for the continued, you know, liberation of Black folks and of all, you know, marginalized community, of trans folks, of queer folks, of all of us. And I say this because, getting back to that question of, like, you know, is this vaccine purposely meant to affect a particular population, and specifically Black women? For me, I've heard rumors out there that they're hoarding vaccines away from Black people to keep them from getting them. And I've also heard the rumors of, hey, we are using, you know, the vaccine to harm people. And to that end, I completely agree with what Maisha was saying too. Just take this information as best as you can, look at it, understand that your emotions, while you have them, if there's a lot of fear there, it is for a reason, and that's perfectly okay. But continue to gather information, continue to ask questions, continue to come out here and ask us these questions so we can be able to help for everybody to make the most informed decision.
Yeah, thank you for that.
Yeah.
Dr. Ruhs, closing thoughts?
I'll keep it short. So I hope we were able to, I don't want to say convince people to take the vaccine. I think everyone is entitled to have their opinion and make their own decisions. But I hope we were able to provide useful information and help people make an informed decision, because only an informed decision can be a good decision. An uninformed decision, you know, might or might not be a good one. And I really encourage, you know, if people get into discussions with friends, family, or social contacts in why people don't want to get the vaccine, rather than just arguing with them, is just ask the question, why not? why not? Often the answer is just based on misinformation or fears, and we can educate people. We can help people make an informed decision by clearing up with some of the rumors and some of the lack of information.
Yeah, thank you for that. And Maisha, closing thoughts.
Closing thoughts.
Sure. Yeah. Bring it on home, right?
Yes.
I'll just say this. Just in reflecting on where you started, Dan, like we did this a year ago. We have literally been in pandemic response for a year, and that's pretty remarkable for a couple of reasons. Aside from, we all know what it is now to kind of live in a global pandemic, right? But I just have to say that I am just in awe of the human spirit and our human connection, and how we as a people, as a culture, have demonstrated such resiliency over the past 12 months. I don't know how we did it, but we have figured our way through, and we're still standing. Yes, we've most definitely lost many along the way, but I just think that we have made a decision to continue to fight and figure our way out through this, and the vaccine is just one of the many different pieces we've tried to we've attacked and brought into our space this past year to get us through this, and so I'm just thankful that we continue to fight every day to figure out how to move forward, and to live in this space, under these circumstances, but continue to kind of be a resource for each other, whether it's a resource of information or a resource of support, with just hand holding and just acknowledging, and validating, what's real for you. I'm hopeful that as we continue to figure out our way through this with the vaccine, getting it to the right people at the right time in this expeditious a way as possible, I'm hoping that we are equally as deliberate in remaining connected. I think one of the most tragic pieces of this past year is that we have lost that sense of, too many people have lost the sense of connection. While many of us have found a way to forge ourselves together, there are too many that are in the margins who continue to be isolated. And I think we have to be more deliberate in going out for those folks and getting them and bringing them back into a part of our society. We can't forget them, because regardless of how this thing goes, this is a new world that we all have to now adapt to, and we want everybody to continue to move forward with that resilience, that fighting spirit, and with hope for an even better, healthier, safer tomorrow. And so I just hope that we can continue these discussions, continue to create these spaces for us, for each other, for our community, and we can stay connected. So thank you for the opportunity.
Yeah,
this is
thank
always
you.
great. Yeah.
We had one last comment, and so I'll just reiterate what, because this is perfectly succinctly sort of to close us out. Jennifer Mayhew says, "Thank you for all this for this informative town hall. You are all appreciated." So I know I appreciate all three of you for coming on and sharing a lot of great information and insight. So everybody, make sure to visit us, chasebrexton.org. We have tons of information. If you want to see more town halls like this, please let us know. Sound off in the comments after this video is posted. It'll be posted. So if you missed a part, you can go back and watch it probably in like 20 minutes. So until the next time, we will see you around. Thanks so much, everybody.
Thank you.
Bye, everybody.
Take care.